Washington State was awarded $10 million through Project Aware, or Advancing Wellness and Resiliency in Education, directly from the Substance Abuse and Mental Health Services Administration, or SAMHSA. Spread over 5 years, the grant builds infrastructure and expands the capacity of the state and district partners around mental health. Washington Project Aware is now in its second cycle. It is the vision of the Washington State Office of Superintendent of Public Instruction that all young learners can be successful. Mental health services, as well as educators, staff, mental health professionals, and community members who have behavioral health training are integral to this success. To ensure equity in our school systems, we must ensure that our schools meet the growing social, emotional, and behavioral health needs of our students. Families, communities, and school districts see that we need a growing response to meet the mental health needs of our youth. Governor Inslee signed an emergency proclamation of the governor declaring a children and youth mental health crisis on March 15, 2021. The social, emotional, and behavioral needs of youth have never been more prevalent. Suicide has gone from the fourth leading cause of death to the second among youth and young adults. In the 2021 Mental Health America report, Washington State ranks amongst the lowest states regarding access to care for youth mental health. Washington State data shows that accessibility for mental health and overall behavioral health services are disproportionately limited among people of color in our state, people living in poverty, and people living in rural locations. For years, untreated mental and behavioral health disorders have been a simmering problem in our nation's schools. Each year, an estimated 1 in 5 U.S. children experience a mental, emotional, or behavioral disorder, including anxiety, depression, attention deficit hyperactivity disorder, and disruptive behavioral disorders. Yet only 20% of them receive care from a specialized mental health provider, according to the U.S. Center for Disease Control and Prevention. Lack of student access across other services leaves schools as informal mental health providers in our communities. Students are not only more likely to be connected with mental health services in their schools, they are also more likely to complete these treatments when offered in a school setting. School mental health research says individuals are 6 times more likely to complete treatment when offered in school settings. Washington State must act. In this project, these goals are threefold. Awareness of mental health issues increases. Connect school-aged youth to services. Train school personnel and other adults to detect and respond. How do we accomplish these goals? Our pathways include increasing literacy and awareness of behavioral health issues among school-aged youth, promoting social and emotional learning, connecting children, youth, and families who may have behavioral health issues with appropriate services, improving school climate, promoting positive mental health among youth and families through social and emotional learning, building the capacity and leadership to sustain community-based mental health promotion, prevention, early identification, and treatment services, providing training for school personnel and other adults who interact with school-age youth to detect and respond to mental health issues in children and young adults. Making sure our teachers and staff receive not only the training required to meet these needs, but that their own mental health and well-being is a priority in our schools. To do this work, Washington Aware has chosen Sunnyside School District, Wahluke School District, and Yakima School District to distribute these funds. To support this work, Washington Aware has partnered with the Healthcare Authority, ESD 105, and Mackey & Associates. Each key player is vital. Aware 2.0 school districts were chosen based on high need in regard to mental health and substantial barriers due to the environment. Powerful connections have been forged across the state and beyond. The team includes members that act as subject matter experts in the areas behavioral health, suicide prevention, equity, student discipline, school counseling, social emotional learning, MTSS, and interconnected systems framework. The team is guided through data and evaluation from Mackey & Associates. District sites may question, that even with this additional funding, how will they make time for this work? The amazing thing about AWARE is that it leverages schools' processes that are already in place. Schools have high-tier goals, and they are well-equipped to braid streams of funding to meet those goals. AWARE takes those goals already in place, and through transformational systems work, it helps each school grow into the goals with teams, systems, foundational knowledge, and strengths they already possess. Let's examine this transformational work in building mental health services inside a school through the metaphor of a tree. Schools and communities have a high priority to grow the best attributes in their schools. We can think about this as the fruit and leaves. These are the things we can visibly see in the day-to-day setting of a school. We view many of these visible attributes as tiered practices that have shown sustainability, positive school climate, equitable discipline practices, destigmatization of mental health literacy and promotion, cross-curricular social emotional learning, and all students connected to mental health needed services. But how do we grow these structures? Foundational work must be in place if we want to see the fruit of our labors. We can think of the soil being watered by AWARE, and with that support, we begin to grow the roots of a transformational system. The roots include a single system of delivery with capacity for creating and sustaining MTSS framework, PBIS practices, and interconnected systems framework. Data collection and monitoring expanded to include student and family and community voice, systems of fidelity, evidence-based practices, universal screening, and expansion of teams to include community providers at all tiers. The roots support the trunk. This includes grant funding for necessary training to align MTSS coaching practices, screening and progress monitoring, mental health awareness, detection, and response. Building capacity to align practice of MTSS and ISF to serve as a single system of delivery for all social and emotional behavior initiatives. OSPI, HCA, and ESD built-in supports. Embedded mental health professionals. Established referral systems. And Tier 1 protective features. And the trunk can grow the branches. This can include MTSS teams following sustainability practices, which means regularly meeting, use of fidelity data, use of student data, and implementation of practices in the classroom, transformational homeschool engagement, educator, mental health professional, and staff well-being supported, and improvement of student emotional and behavioral health, as well as social connectedness. It is only after great care in fostering these foundations that we truly see the fruits of our labors, and students can benefit from these systems. This is the overarching framework of AWARE. Through its resources, both financial and state support, it can water a system that aligns with the structures and values of each school site. I have mentioned the interconnected systems framework, and just briefly would like to define this common language. ISF builds off of PBIS already prevalent in schools. Using this same tiered structured model, we can now systematize and create growth for mental health frameworks in schools. The Interconnected Systems Framework is a structure and process to integrate positive behavioral interventions and support and school mental health within school systems. The goal is to blend resources, training, systems, data, and practices in order to improve outcomes for all children and youth. There is an emphasis on prevention, early identification, and intervention of the social, emotional, and behavioral needs of students. If we were to look at a basic interconnected systems framework in alignment with AWARE, it might look like this. A foundational level of awareness and support must be present and continually grown through families and the community at large. We can then think about all students receiving Tier 1 services in a school. Tier 1 in any given school would include practices that make sense for the community, and also include universal screening, PBIS, and MTSS frameworks, and training for all adults who help facilitate services within the school. Some students take part in Tier 2 services, as they are identified in the school's universal screening model. They could receive small group activities and targeted screening. Few students would receive Tier 3 services, including services from embedded mental health professionals and the community partnerships AWARE helps facilitate. This tiered structure is the work AWARE helps connect with structures already in place in schools and helps becomes transformational and sustainable in nature. School mental health is at the forefront of our community right now, and AWARE is here in Washington to act and help facilitate the infrastructure and capacity for these connections. For additional information, visit our website and connect with OSPI. Thanks for watching.